talk about two aspects of the Affordable Care Act. One is the marketplace where people that have a higher income can purchase health insurance. To this date, we have about 6 million people across the nation that now have health insurance, thanks to the Affordable Care Act. What we're talking about here is Medicaid for people that are very low income, working Virginians. Up to 400,000 of them could get, just in Virginia, could get health care. Probably nationwide, we're talking about maybe 10 million people that could get coverage. 27 states, as of today, have expanded Medicaid. Probably by the end of the legislative sessions across the country, we'll probably be closer to 30. A large majority of the country is going to expand Medicaid. And you can't emphasize the economics of this enough. We are already paying for the people that are sick. The Supreme Court made it optional for states to expand Medicaid, but what they didn't make optional is for the amount of money that taxpayers are paying for Medicaid expansion. If you think that we can get out of participating in the Affordable Care Act, we are already on the hook. We are already participating in the Affordable Care Act. Through your tax dollars, $5 million a day, you heard, are going to the federal treasury and they're not coming back. We can do a much better job with that. The second point that I would tell you is that in the budget that we just passed, of course, in your budget we just passed to make the hospitals whole, we put $150 million on the table that if we expanded, we wouldn't have to do that. We wouldn't have to give that money to Inova, Virginia Hospital. And that crowds out what we're doing right here behind us, the pie chart. Well, it's not there anymore. But the pie chart, we could spend that more on health care. We could spend it more on public safety.
Or higher education.
Or higher education, or any of those types of things that we wanted to invest in. So we're already on the hook on these things. And oh, by the way, the people that are still uninsured still get sick. And economists tell us that it adds about $1,000 per year to each individual's premium on average. So we're already paying for the sick. And we can't wave our magic wands and hope that people don't get sick. So we're already participating. The economics of this are just so overwhelming. I apologize, I do have to leave. I have to go to another event. But I do want to tell you, if you're inclined to help in this process, we have an online petition that you can go to and sign on. The opponents also have their own petition. We need your help. The petition, you can go to it on the website. It's coverallva.com. That's coverallva.com. And thank you again for your interest, and thank you for being here.
I'll pass it over now to Don.